Spectrum Health is creating a new program aimed to help mothers-to-be with high-risk pregnancies. The new Fetal Care Center will join expert forces with maternal fetal medicine specialists and Helen DeVos Children's Hospital experts. And so here to tell us more about this program is Elizabeth Marcus.
Thank you for having me.
Well, thanks for being here. You're a nurse navigator, Elizabeth. Can you kind of tell us a little bit about that role, because it's very unique?
Yes. So as a nurse navigator, I was trained as a nurse. I have background experience in labor and delivery. That clinical experience helps me to know how to navigate patients through the healthcare system. So I'm here to be a single point of contact for patients who see so many different specialists, so they have one person to go to with any questions or concerns that they may have. I'm here to coordinate their care, schedule appointments for them, answer their questions, connect them with other resources. And my goal really is for patients to not feel alone during this time, because they're walking through a time that can be overwhelming and stressful with a new diagnosis.
Yeah.
And I'm here to walk alongside them, to advocate for them so that they don't feel alone, so that they feel seen and heard and cared for by our team.
Yeah, and so I have to think, being a new mother is stressful enough. And then when you have something that involves a high-risk pregnancy, or you are dealing with issues after the birth, it's really peace of mind to have someone like you by the side. And so tell us about the new Fetal Care Center and the specifics that it offers to new mothers.
Yeah, so we work seamlessly together with a team of high-risk OBs, as well as pediatric specialists at the Helen DeVos Children's Hospital. We do our best to accommodate each patient's unique needs. For example, if a patient is coming in from out of town and she would like all of her consults to be in the same day, we can make that happen. Whereas if they prefer to have their consults spread out to process them over a longer period of time, we can do that too. So I'm here to schedule appointments for them and just to make life easier for expectant mothers.
Yeah, so who might be a patient that you would see at the Fetal Care Center?
Yeah, so we see a wide variety of patients with all sorts of different diagnoses. For example, if a patient goes to their primary OB for their 20-week anatomy scan and something of concern comes up, they may refer them to us.
And when you go to an appointment, how exactly does that work?
So typically, the first appointment starts with an ultrasound to confirm whatever the suspected diagnosis is. Then our maternal fetal medicine physician comes in and reviews that diagnosis with the patient and explains it to them in a way that's easy to understand. They may meet with a genetics counselor if that's appropriate as well. And I'll meet with them myself as a navigator. And together as a team, we really come up with a personalized plan of care that best fits the needs of that patient. I'm here to be a dedicated contact for them, because we know that these patients are coming to us in a time of crisis, and they can be overwhelmed with just all the new information that's being thrown at them about a diagnosis. So we really do our best to break down the details of that in a way that's easy to understand, so that patients know what best to expect during this pregnancy, during labor and delivery, and beyond.
I bet it's highly emotional. There's so many unknowns. You haven't even seen the baby yet. You're being told about something that your family is dealing with. And so in crisis is definitely a good way to describe that. What else should moms and families know about the Fetal Care Center?
Yeah, well, I want moms to know that we do our best to provide an accurate diagnosis using the latest technology. We're here to guide them and walk alongside them every step of the way, from their first appointment to their last. And that's really something that I love most about my job, is getting to build relationships with these patients over the course of a longer period of time, over their whole pregnancy versus just a few days in the hospital. And I'm here to connect them with any and every support and resource that they need.
Yeah, and if people have questions, you can inquire about this. It's amazing that Spectrum Health has this team of experts and health professionals right there in case you need it. So there's the number on the screen, and then also you can check them out online. And Elizabeth, thank you so much for stopping by.
Thank you so much for having me.
We appreciate your expertise in what you're doing.
Of course. Thank you.
And we'll be right back with more 8 West. Don't go away.